Hi everybody, my name is Dustin Simmons. I'm an LPN to BSN student at Indiana State University, and this is my presentation on immigrants and refugees in healthcare. Before we get started, I would like to ask you guys to go to the pretest and take the pretest, just so you can kind of gauge where you're already at on this subject. The learning objectives I would like everybody to walk away with is I would like students to be able to identify what this population is, both on paper and when you're out practicing nursing. I would also like students to be able to identify what the biggest barrier to healthcare that exists in this population, and also identify the solution that we can use to bridge this communication gap. First, I would like to take a second to just define what this population is. First, an immigrant is someone who travels from their native land to a foreign land to live permanently, be it for a better life or just because they want to change the scenery. Just anybody who leaves their home to make a new home in a foreign land. Next, we have refugees. This one is different than what immigrants are. A refugee is an individual or group that is forced out of their home because of either disaster, war, persecution. There's some external driving force that is forcing them out of their home into a foreign land. As America sees an influx of both immigrant and refugee populations, what we're seeing is these people have a few issues when seeking healthcare. Some of those barriers are financial concerns. Some of these folks may not have a job, or their legal status may be in question, so they're unable to find work, which would obviously not allow them to get the healthcare that they need. Unfortunately, they could still be facing some form of discrimination, whether it's outward or more subtle discrimination. But one of the biggest barriers I feel is communication. Communication is a vital piece of what we do in healthcare, and if we cannot communicate appropriately and effectively, our patients are going to suffer. As we just touched on, communication is the largest barrier to overcome. Some of these folks may not have even a working knowledge of the English language, which is the primary language spoken in America. And even if they do have a working knowledge, healthcare and healthcare terminology is a completely different world. So these folks could be tracking a conversation, and all of a sudden we start in on our medical jargon, and any progress and any comprehension of what we were saying is lost when we hit those our medical jargon. Communication is, as we stated, vital to every facet of healthcare. It's vital to direct patient care, vital to patient teaching and family education. And it's also vital to scheduling follow-up appointments to get these folks the follow-up treatment that they may need. And I'm sure all of us have been in a situation where we have been in a patient's room and they were just simply not understanding what we were saying. It makes for a very difficult treatment situation, and frankly just makes for poor patient care. So that kind of brings us back to why this is important. As we said, this literally affects every facet of what we do in healthcare. It impairs our abilities as healthcare professionals to be effectively communicating with our patients, which then in turn means we are not providing effective care to our patients. Also, the Title IV of the Civil Rights Act states that any providers who receive federal funding, this would be Medicare, Medicaid funding, or just any grants that the government does issue, these providers are not able to discriminate against any patient or patient population. And if these providers do not have some form of communication or will not accept these patients, that is a form of discrimination. And also, here in the US, as the world is in a rather tumultuous state right now, individuals with limited English proficiency, which would be the immigrant and refugee population, number about 55 million people, which is a very large portion of our patient population. So, how can we as healthcare professionals help bridge this gap and help solve this solution? That's the use of interpreters. They're ad hoc interpreters. These are people that are not formally trained as medical interpreters, but they are fluent in the language and can help communicate the message that needs to be communicated. These people can be anyone, really. These people can be family members, other staff members who may not be nurses or CMAs or doctors. And if it's an emergency situation, these people could literally be anybody. Just anybody who can help get the message across on what the patient needs to do or what is going on. Next, we have medical interpreters, and these are people who are specifically trained in medical jargon and communicating with patients. Now, the one thing I do want to kind of touch on is it's important to remember that even though interpreter services may be offered, does not mean that that specific dialect of the patient's language is available. Sometimes with less popular dialects, they're just simply not available, which would further inhibit patient care unless there's an ad hoc interpreter available. Now, there are several different types of interpretation service. There's in-person, which would be a face-to-face individual. There are video-based, which would be obviously a video, and then there's a telephonic means. All three of these are effective. Probably the most effective would be the in-person because the patient would be able to get a full sense of the interpreter's body language, of your body language, and also obviously the spoken word. Now, just some important reminders. Interpretation services may not be a magic fix, and they might not be able to fix every communication issue. As we spoke on a little bit earlier, there could be a specific dialect issue that is not available, or the person scheduling appointments for the doctor may not speak that dialect, and that would lead to a breakdown of communication because the patient wouldn't know the provider is trying to reach them. And also, when we do have interpretation services, it's very important to remember that we are still addressing the patient, not the interpreter. In conclusion, the number of individuals that have limited English proficiency are increasing, and the need for interpretation services will assist us in bridging that gap. Thank you. Thank you for listening. I would like everyone to go ahead and go to the post-test section and evaluate how well this class did for you. Thank you very much for listening, and have a great day.